Hello, we are from SGD B4. We would like to present our student project entitled Tuberculosis in Adults.
Okay, thank you for your time. Hello, my name is Naomi Margareth Panjaitan, and my last digit of student number is 167. Here I'm going to explain about the background of our student project. Globally, tuberculosis or TB is the second leading infectious disease killer after COVID-19. It's estimated that about 10.6 million people in the world suffer from tuberculosis. Nowadays, Indonesia is the second country with the highest TB burden. It's estimated that there are around 969,000 cases of tuberculosis in Indonesia. Okay, next about the treatment coverage. Treatment coverage describes how many TB cases are found and can be covered by the TB control program compared to the estimated existing TB cases. Until now, there has been an increase in the treatment success rate in 2021, but until October 2022, TSR for 2022 is still 82% of target 90%. It means that the treatment success rate has not achieved yet. That's all from me. The next slide will be presented by my friends. Thank you.
Greetings, my name is Komang Jaya with my last digit number 037. I will continue the presentations about the background of our student project. Tuberculosis is a disease that has been around for a long time and many efforts have been made to reduce the number of TB cases both globally and locally in Indonesia. However, the number of TB cases is still high and has not been eradicated. Turning to the comparisons to total cases of TB in adults and children, the number of TB cases in adults is greater than in children. Therefore, the student project will analyze the cause of the high number of TB cases in adults, clinical symptoms, complications, diagnosis, and treatment in TB adults. These are the problem formulations for our student project, and these are the purposes to understand the definitions of Mycobacterium tuberculosis, to understand epidemiology of tuberculosis in adult, etiology and risk factors of tuberculosis in adult, clinical manifestations and complications of tuberculosis in adult, understand the method that is used to diagnose and manage tuberculosis, to understand tuberculosis from the perspective of national health system in Indonesia, and how health promotions in primary care impacts the number of TB cases, and to understand tuberculosis prevention in community. For the benefits of our student project, include complete knowledge of tuberculosis starting from the definitions, epidemiology, etiology, clinical manifestations, complication diagnosis, treatment, preventions, and to find other further knowledge of TB from the perspective of National Health System Indonesia. The benefit for the community include increasing knowledge in the community to have a better understanding of tuberculosis and the appropriate prevention and management for it. That is all from me. The presentation will be continued by my friend. Thank you.
My name is Madikina Devi Vital with last digit number 197, and I will explain the definition and epidemiology. TB is a highly infectious and potentially deadly disease caused by the bacterial Mycobacterium tuberculosis. TB is usually transmitted through inhalation of airborne droplets containing the bacteria, when an infectious person coughs, sneezes, or talks. Once inhaled, the bacteria can cause infection in the lungs, causing various symptoms, including coughing, fever, weight loss, and chest pain. TB remains a major global health problem with an estimated 10 million new cases and 1.4 million deaths worldwide in 2019. Okay, that's all for me. Thank you.
Greetings, my name is Felix Zefanya Lubis with my student ID number 113, and now I'm going to explain about the etiology and risk factors of adults tuberculosis. The causative organism, Mycobacterium tuberculosis, is a complex acid fast bacillus, and because of the VR Regulant genetic program, it may live in a quiescent state in a hostile microenvironment within the patient's body. It is estimated that third of global population has MTB in this dormant form, which causes latent tuberculosis infection. MTB is a pathogen that has been successful since evidence of its sickness has been discovered in bone preserved from 4000 before Christ. MTB has been classified as an obligatory pathogen in humans since individuals with fibrocavitary lung disease typically cough up bacilli that spread the disease. And usually, the respiratory route is used to spread tuberculosis. MTB has three possible outcomes in the lungs. It can either be eliminated by the immune system, stay dormant, or cause an active infection. The, the consequence is a spectrum of tuberculosis states ranging from no infection, latent to subclinical illness, to overt active disease, depending on the immunological condition of the host. Pattern recognition receptors produced by macrophage, dendritic cells, and epithelial cells interact with MTB lesions in patients who have never been exposed to MTB before. As a result, the innate immune system starts to build granulomas and produce inflammatory cytokines and chemokines that draw additional cells to the infection site. Humans typically experience the adaptive immune response 4 to 6 weeks after MTB antigens are presented by the dendritic cells in lymph node. Some researchers have hypothesized that innate immune system may facilitate the spread of MTB to other tissues, since it's less effective at fending off infections. The adaptive immune system, which is primarily of the Th1 delay kind, protects the host from infection by enclosing MTB in granulomas and stopping it from spreading the other tissues due to granulomas bacillary death. The development of adaptive immunity marks the morphological and functional maturity of tuberculosis granulomas, which it has been demonstrated that the early manifestation of MTB infection affects the outcome, and this is just a possible target for functional imaging to predict the outcome at an early stage, which could be helpful in creation of successful TB intervention strategies or effective vaccines. And there are several risk factors of tuberculosis in adults, such as low socioeconomic status with limited access to healthcare, smoking, crowded living circumstances, conditions that inhibit the host immune system, or immunocompromised such as lymphoma, diabetes mellitus, and stage of renal failure, and post-transplant situation. That's all from me. Thank you.
My name is Gede Bayu Bramantara, with my last 3-digit student ID number is 057. In this session, I'm going to explain about clinical manifestation of TB. As we know, TB could be generally classified into two: this pulmonary TB and extrapulmonary TB. Pulmonary TB, the infection site is in lungs. One with pulmonary TB can show chronic progressive cough. It is within 2 weeks or more, plus hemoptysis sometimes. Night sweating, body weight decrease, chest pain, but this is unlikely, and fever is also unlikely. And then in extrapulmonary TB, the clinical manifestation could be varied, depends on the infection site. The most common infection site are lymphadentic TB, pleuritis TB, and bone TB, and also one with quite unique manifestation, but relatively rare or uncommon, is cutaneous TB.
Hello everyone, my name is Natasha Pusparani with the last 3-digit number of 227, and here I'll be continuing the presentation, and today I'll be discussing about the complications of tuberculosis. Tuberculosis itself can impact on patients' health significantly and lead to death. Several complications may include, first, extensive destruction of the lung. This usually occurs in chronic progressive TB patients or patients having inadequate treatment, resulting in respiratory dysfunctions and disorders. Second is bronchiectasis, which is usually occur when there is an extensive destruction of the lung due to pulmonary TB, and several clinical features present include increased expectoration, decreased FEV1, and hemoptysis. Third is hemoptysis, which is the coughing up of blood, but it does not necessarily mean that TB is active. It is usually what happens at the beginning, during treatment, or post-TB cure. Fourth is pneumothorax, which occurs if a TB cavity near the subpleural of lungs bursts and it enters, and the air enters around the lungs. These complications are often due to delayed treatment and poor adherence to medication. Moreover, several factors such as inadequate healthcare facilities, shortage of staff, lack of awareness, limited facilities to perform tests, lack of access to necessary TB drugs would most likely contribute to these complications. Thus, identifying, screening, treating optimally, and monitoring patients are necessary. That is all from me. Next will be continued by my friend.
My name is Mira Ambagrace Fritscha with the last 3 digits of my student ID number 018, and I will talk about diagnosis. So the medical diagnosis of Mycobacterium tuberculosis is done by isolating the bacteria through complex bacilli through body fluids. Initial testing can also be done for pulmonary tuberculosis, such as chest X-ray, with the initial findings are pulmonary infiltrate with white triangles and caving formation present in the apical region. Sputum analysis can be done through acid-fast bacilli smear, mycobacterial culture, and nucleic acid amplification testing, or NAAT. If there is a problem in sputum production, nebulized hypertonic saline can be used to induce sputum. The community tuberculosis diagnosis involves a comprehensive examination of the community's health state that focuses on the prevalence, risk factors, and socioeconomic determinants of TB. The procedure is gathering and analyzing epidemiological data such as incidence and prevalence of TB cases. Tuberculosis is much more common in particular socioeconomic groups and people who have certain risk factors. The diagnosis of TB in the community also implements preventive strategies, health education initiatives, and policy recommendations that address the unique challenges posed by TB within the specific community.
Hello, my name is Gede Sutha Samudra, number 0 to 3. Now I will explain you about the treatment. Comprehensive approaches involves a thorough assessment of the patient, considering not only the physical aspects, but also the psychosocial and environmental factors influencing TB management. One is clinical assessment. Conduct a detailed clinical examination, including chest X-ray, sputum analysis, and other relevant diagnostic tests. Two is psychosocial assessment. Evaluate the patient's mental health, socioeconomic status, and living conditions to identify potential barriers to treatment adherence. Three is an environmental assessment. Assess the household setting to identify and address factors contributing to TB transmission. And four, a mix. TOT stands for Directed Observational Therapy, which is a key strategy for TB treatment. TOT contains of 5 elements. One is sustainable political and financial commitment. Two is adequate laboratory diagnosis, forms the cornerstone of effective tuberculosis management. Three is standard treatment administered under direct observation, ensures consistent and reliable care delivery. Four, if provision of high quality and stable anti-tuberculosis drugs is essential for the success of treatment regimens. And five, strict regimen of monitoring and evaluation, coupled with accountability for each patient outcomes, is crucial for maintaining the integrity and effectiveness of TB control efforts. That's all from me. Thank you.
Hello, my name is Luh Wina Saraswati with the last digit of student ID number 142. Now I will explain about the tuberculosis national health system in Indonesia. So currently there are significant funding gaps in key areas of TB care and prevention in Indonesia, and national funding mechanisms do not adequately support efforts to rapidly find TB patients and provide effective treatment. To address these TB funding barriers, the Joint External Monitoring Mission recommends that the Indonesian government consider establishing a PACE payment mechanism from the National Health Insurance or Jaminan Kesehatan Nasional Program for TB service. Although GKN coverage is currently high, about 90%, there are also issues with how patients use GKN to diagnose and treat tuberculosis. A significant proportion of TB patients first visited hospitals, private and public rather than primary healthcare facilities. This results in a higher financial burden for GKN, as the medical bills GKN pays to the hospitals are higher than those paid to PHC because Indonesian case-based group payments are more expensive. Therefore, from an efficiency perspective, diagnosis and treating TB patients at a PHC is a more cost-effective option. That's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Nadya Zalfa Aqilah with the last student digit number 079, and I would like to deliver the tuberculosis health promotion in primary care. So health promotion will be crucial in enhancing treatment adherence, TB knowledge and awareness, health-seeking behavior, and treatment outcome for TB patient suspect. And according to Journal 2020, the significance 3 key tactics for tuberculosis prevention and control that has been successfully implemented for many years are: 1. Identifying those with active tuberculosis by also providing information about TB transmission, symptoms, and preventive measurement. Number 2, identifying and vetting individuals who have interacted with TB patient in order to ascertain whether they have active TB, whether they have been infected, or whether or not treat children or other high-risk individual who may benefit from window prophylaxis. Number 3 is screening, testing, and treatment for other selected person and population at high risk for latent TB infection. And WHO also addressed a broader range of health-related behaviors that aid in prevention and treatment tuberculosis, such as better nutrition, quitting smoking, abstain from alcohol, and behavior that prevents tuberculosis. Thank you.
Hello, my name is Bintang Dila Puspapitari. With my last 3-digit student ID number is 157. Here I'm going to continue to explain the next chapter, which is prevention of TB in community. Prevention of TB in not infected case, such as personal protective equipment like wearing a mask, maintaining air circulation and sunlight, good nutritional intake, BCG vaccine, especially for children, and cover their mouth and nose when cough or sneeze. For people with active TB, such as consultation and anti-TB treatment from the doctor, wearing a mask, maintaining clean environment and personal hygiene, and also consuming nutritious foods. And prevention of TB for latent TB patients is prophylactic treatment or TPT, which is a 12-dose regimen of isoniazid and rifampicin. That's all from me. Thank you.
My name is Natasha Pradnya Devi with 3-digit number 056. Now I will explain the conclusion of our student project. Tuberculosis or TB is a highly contagious and potentially fatal disease caused by Mycobacterium tuberculosis. It is primarily affecting the lungs, but with the potential to impact other body parts. TB poses a significant global health threat where airborne droplets are the primary mode of transmission. Pulmonary TB often manifests with symptoms such as chronic productive cough, fever, night sweats, shortness of breath, chest pain, and reduced appetite. Complications may include extensive lung destruction, bronchiectasis, hemoptysis, and pneumothorax. Community tuberculosis diagnosis involves a thorough examination of epidemiological data, assessing the community health state. The comprehensive TB approach encompasses clinical, psychosocial, and environmental assessment. Health promotions play a vital role in improving treatment adherence, TB knowledge, awareness, health-seeking behavior, and treatment outcomes for patients and suspects. The family medicine approach is crucial in preventing and controlling TB spread, where preventative measures for non-infected individuals include the use of personal protective equipment, maintaining proper air circulation and sunlight in the workplace, and ensuring good nutritional intake. And that's all from us. Small group discussion before about tuberculosis in adults. Thank you.